topic for our SGD is regulation of blood glucose. Okay. So you have completed all the whole carbohydrate metabolism. Okay. So it will be easy for you to understand now the regulation of blood glucose. From your carbohydrate metabolism, you already know that glucose is a very important molecule among all the carbohydrate. Okay. So before going to regulation of blood glucose, we must know what is the normal level of blood glucose. What is normal level? 72? 110. Fasting unit? Milligram dl. Okay. So fasting blood glucose . 70 to 100 milligram per dl. And what is postprandial blood glucose level? Less than, not greater than, less than. Postprandial blood glucose, that is up to 140 milligram per dl. When the question is asked that what is blood glucose level, then you have to give the answer in two heading. Number one, that is fasting blood glucose, and number two is postprandial. Okay, postprandial blood glucose is up to 140. That means it may be 100, it may be 90, it may be 130, but not more than 140 in healthy individual. Okay, and fasting blood glucose is 70 to 100. Now, if blood glucose level falls below the 70, that means below 60, 50, 40, then the condition is called hypoglycemia. Very good, hypoglycemia. And if the blood glucose level goes above the upper limit, that means above 100 or above 160 in case of postprandial, then it is called hyperglycemia. Hyperglycemia. Now give me example of hyperglycemic state. Diabetes mellitus. Diabetes mellitus. And hypoglycemia can be seen in starvation. Very good, starvation. So if blood glucose level goes below the normal limit, then there will be hypoglycemia, and if blood glucose level goes above the upper limit, then there will be hyperglycemia. Hypoglycemia is a very critical condition and fatal condition, because if there is hypoglycemia, so there will be a deficiency of glucose, that means deficiency of ATP. ATP cannot be produced, and there is a deficiency of ATP also in nervous system or brain. So there will be coma, and sometimes it can lead to death. So hypoglycemia is a very fatal condition. Okay. And also hyperglycemia that may lead to diabetes mellitus, and diabetes mellitus has its own complication. It can cause retinopathy, neuropathy or nephropathy. So hypoglycemia and hyperglycemia both are dangerous for our health. So body has to keep the blood glucose level within this limit, narrow limit, and to keep this blood glucose level within this range, there must be some mechanism. Okay, that is called regulation of blood glucose. Okay. So we have to keep the blood glucose level within this limit. Now concentration of blood glucose is maintained by two sets of factors. Number one, factors that causing addition of glucose into blood. Factors causing addition of glucose into blood. It is blood vessels. So number one is factors causing addition of glucose into the blood. A second factor that causing leaving of glucose from blood. Okay, leaving of glucose from blood. Okay. So what are the factors that causing addition of glucose into the blood? Cause of glucose, cause of addition of glucose. Huh? Diet. Number one, diet. That means when we take food, then glucose is absorbed through intestinal epithelium. Then the glucose will come into the blood. So after taking meal, absorption of glucose via intestinal epithelium. What are the receptors present in intestinal epithelium to absorb glucose? Name of the receptor? SGLT, sodium dependent glucose transporter, and another GLUT. Koto? Which number? Not 4, 2. GLUT 2. Okay, GLUT 2. GLUT 2 SGLT. Acha, GLUT 4 is present in? GLUT 4? Very important. Insulin sensitivity. Only GLUT 4 has insulin sensitivity. Present in muscle and adipose tissue. Okay. Hate GLUT 4 থাকে না। GLUT 4 is important because আমি পরে বলবো, because it is sensitive to insulin, but the rest are not insulin sensitive. Okay. So this GLUT, SGLT, this is very catch question for your MCQ and Viva. Okay, try to remember all this type of GLUT, mainly GLUT 2 and GLUT 4. These are important, GLUT 2 and GLUT 4. Okay, so this is the first point, absorption of glucose via intestinal epithelium. Second point, glycogenolysis, breakdown of glycogen. Yes, glycogenolysis. Breakdown of glycogen will give rise to glucose molecule and it will come into the blood. Then very good, gluconeogenesis or neoglucogenesis. And fourth, there are some hyperglycemic hormone like glucagon, glucocorticoids, catecholamines. Okay, they will also give rise the blood glucose level. So some hyperglycemic hormone. Like glucagon, glucocorticoid, catecholamine. So we have discussed the first sets of factors. Now coming to factor causing leaving of glucose from blood. The first cause ki hobe leaving of glucose, means utilization of glucose, that means glycolysis, utilization by cell. Then second, glycogenesis, excess glucose will be stored as glycogen in where? Liver and muscle. Glycogenesis. Then third, there are some Hypoglycemic hormone like insulin. Very good. Insulin, hypoglycemic hormone. Like insulin. Fourth is lipogenesis. Lipogenesis means synthesis of lipid. Okay. So when you will read lipid metabolism, then there will be a chapter, there will be a pathway called de novo synthesis of fatty acid. Okay, de novo synthesis of fatty acid. The first starting molecule of this pathway is acetyl CoA. Acetyl CoA comes from glucose. Okay, so lipogenesis, there is de novo synthesis of fatty acid. De novo synthesis of fatty acid, which requires acetyl CoA, which comes from glucose. Okay. Also, when you will read synthesis of amino acid, then you will see that there are various derivative of glucose which takes which participates into amino acid synthesis. Okay, there are many derivative of glucose. So glucose also channels to synthesis of amino acid. So synthesis of amino acid. Synthesis of amino acid. So these are the causes which affects leaving of glucose from the blood. So addition of glucose and leaving of the glucose. Thus the concentration of blood glucose is maintained. Okay, the exact concentration of blood glucose is maintained. Now what happens when we take food? When we take food, then blood glucose level start rising. Okay, 1 hour after taking food, the value of blood glucose level reaches its maximum level. Then it starts falling gradually. Okay. Y-axis time, 0 hours, 0 hour, 1 hour, 2 hour. Along x-axis blood glucose level. Okay. So after taking food, after 1 hour, it reaches its maximum level. Okay. Then the insulin starts secreting and the value gradually falls. But it will never touch the ground level, okay, because there is a minimum glucose level. Touching ground level means death. Okay, so there will be a minimum level that is up to 70 or up to 60. So what happens in fasting and fed state? Fasting state. Fasting state means we have not taken food for how many hours? Fasting state? 8 to 10 hours. Generally 8 to 10 hours for collection of blood sample. Okay. In our laboratory, we collect the blood sample for fasting. Then patient is asked not to take any food for up to 8 to 10 hours. Okay. Then the sample is called fasting sample. But in general case, if we don't take food for 4 hours, then fasting state already has started. Okay. But for clinical sample purpose, sample collecting purpose, the guideline is 8 to 10 hours. So when we have not taken food for long time, then the blood glucose level starts falling. So excessive falling is very harmful for our body. So there must be some mechanism which prevents excessive falling. Okay. So what are the mechanisms we will see? Whenever blood glucose level starts falling, then there will be secretion of which hormone? Glucagon. As soon as blood glucose level starts falling, then there is a secretion of glucagon. Secretion of glucagon. So glucagon, we know that glucagon is a hyperglycemic hormone, so it will show some action so that blood glucose level start rising. So what will it do, glucagon? So in fasting state there will be inhibition or activation some pathway. So there will be inhibition of glycolysis, because we now need to store glucose, not break down, okay. So first there will be inhibition of glycolysis, then there will be activation of breakdown of glycogen, that is glycogenolysis, so that glucose molecule can come. Activation of glycogenolysis. So inhibition of is opposite, that is glycogenesis, inhibition of glycogenesis. And what will happen to gluconeogenesis? Activation of gluconeogenesis. Neogenesis. There will be breakdown of muscle protein. Muscle protein breakdown will give rise to breakdown of protein, means we will get amino acids, and this amino acid helps to enter into the gluconeogenesis. So breakdown of muscle protein, breakdown of muscle protein give rise amino acid, and this amino acid will be channeled into gluconeogenesis, okay. And in the late stage, very late stage, body will start utilizing fatty acid so that glucose is spared for our brain, okay. Late stage, in late stage body will start utilizing fatty acid. In early stage this mechanism will happen, but in late stage body will start utilizing fatty acid and glucose is spared for brain. Glucose is spared for brain, okay. So in fasting state means 8 to 10 hours, overnight fasting means 8 to 10 hours we have not taken food, so blood glucose level starts falling, but the excessive fall is prevented by some hyperglycemic with action of some hyperglycemic hormone like glucagon plus other hyperglycemic hormone, okay, glucocorticoid and also catecholamine. Major role is of glucagon, but this glucocorticoid and catecholamine also show some action, okay. So as soon as blood glucose level starts falling, glucagon starts increasing, glucagon level increasing, and it will show this metabolic changes, okay. It will inhibit glycolysis, it will activate glycogenolysis, it will inhibit glycogenesis, and it will activate gluconeogenesis, okay. And there will be breakdown of muscle protein so that amino acid can come from protein and it will be channeled into gluconeogenesis. And in the late stage there will be utilization of fatty acid so that brain can utilize the glucose, okay. So this happens in the fasting state. Now we will see what will happen in the feeding state. Feeding state, fed state. Fed state means we have taken food, so lots of glucose into the blood. So as soon as we taking food, the blood glucose level start rising. But excessive, here also excessive rise is harmful for our body. So there must be some mechanism which prevents the excessive rise of blood glucose level, okay. So what are the mechanism? As soon as blood glucose levels start rising, then the hormone, which hormone will secrete? Insulin, okay. Insulin, hypoglycemic hormone, insulin. Insulin starts secretion, and insulin will activate glycolysis, okay. It will activate glycogenesis, that means synthesis of glycogen, and it will inhibit glycogenolysis. What will happen to neoglucogenesis? Inhibition of neoglucogenesis, and it also channels glucose to synthesize amino acid, okay, to synthesize amino acid. These are opposite to this pathway, okay, opposite to this pathway, because action of insulin is opposite to glucagon. This is easy to remember, okay. You have to just write what happens in fed state, that is when we take food, then blood glucose levels start rising, and excessive rise is must be prevented, because hyperglycemia is dangerous for our health. So insulin start rising, and insulin shows the following metabolic changes, okay. So activation of glycolysis, activation of glycogenesis, you will write all these things, and at last it channels the glucose to synthesize the amino acid, okay. So this happens in the fasting and the fed state. So we have discussed what is the normal level of blood glucose, what is called hyperglycemic state, what is called hypoglycemic state, what hyperglycemic and why hyperglycemic and hypoglycemic state are dangerous, then factor causing addition of glucose, factor causing leaving of glucose, then what happens in the fasting state, what happens in the feeding state. Now we will discuss the role of endocrine, that is individual hormone, role of endocrine. So glucagon is a peptide hormone synthesized from which cell? Alpha cell of pancreas, okay, it is a peptide hormone, and it acts via GPCR. GPCR means G protein coupled receptor, okay, acts via G protein coupled receptor. This is a signaling pathway. There is a separate chapter about the mechanism of action of hormone, okay, and there you can see that what is GPCR and the detailing of the GPCR. For this time being, just remember glucagon acts by using G protein coupled receptor, okay. Acha. Glucagon peptide hormone acts via GPCR. Acha. Now coming to the individual regulation, glycolysis. Achha, by using GPCR, glucagon phosphorylates or dephosphorylates some enzyme, okay. You all know that activity of an enzyme depends on whether it is phosphorylated or dephosphorylated. There are some enzyme that activated, their activation form is phosphorylated form, or there are some enzyme whose activated form is dephosphorylated form. So by using this mechanism, phosphorylation, dephosphorylation, glucagon works, okay. So what happens in glycolysis? It inhibits pyruvate kinase. Pyruvate kinase. In which step pyruvate kinase is needed? Pyruvate kinase? Second, pyruvate. Very good. So it inhibits pyruvate kinase. It inhibits production of fructose 2,6-bisphosphate. Fructose 2,6-bisphosphate. Fructose 2,6-bisphosphate is not a product of glycolysis, okay. It's a product by action of phosphofructokinase 2, okay. So it inhibits fructose 2,6-bisphosphate. Now fructose 2,6-bisphosphate, it activates phosphofructokinase 1. Phosphofructokinase 1 is an enzyme of glycolysis. So activation of phosphofructokinase 1 means activation of glycolysis, okay, activation of glycolysis. So what glucagon do? What does glucagon? Inhibits production of fructose 2,6-bisphosphate. So inhibition of fructose 2,6-bisphosphate production means inhibition of the whole pathway, okay, inhibition of the whole pathway. So in glycolysis, glucagon inhibits pyruvate kinase and it inhibits production of fructose 2,6-bisphosphate, okay, and thus it inhibits the glycolysis, okay. So this is the detailing mechanism. Now coming to glycogen metabolism. What happens to glycogen metabolism? it activates glycogen phosphorylase. Phosphorylase is enzyme of কি glycogenolysis না glycogen synthesis? Glycolysis. Glycogenolysis. So it will inhibit the key regulatory enzyme of glycogen synthesis. What is the key regulatory enzyme? Synthase. Glycogenesis. Okay. You can remember easily that is here is P for positive. Okay. So you can easily remember. It activates, gives positive effect to glycogen phosphorylase. Okay. This is about glycogen metabolism. Now coming to gluconeogenesis. In case of gluconeogenesis, name some key regulatory enzyme of gluconeogenesis. Yes, it is in short it is written as PEPCK, phosphoenol pyruvate carboxykinase. From which substance to which product? OA to oxaloacetate to phosphoenol pyruvate. It activates phosphoenol pyruvate carboxykinase and also activates glucose 6-phosphatase. 6-phosphatase. Glucose, these two enzymes. Okay. It activates phosphoenol pyruvate carboxykinase and glucose 6-phosphatase. Okay. This is for neoglucogen. Acha. So glucagon acts via using G protein coupled receptor. It acts via phosphorylation and dephosphorylation of enzyme, and these are the metabolic effect. In case of glycolysis, it inhibits pyruvate kinase and inhibits production of fructose 2,6-bisphosphate. In case of glycogen metabolism, it activates glycogen phosphorylase, inhibits glycogen synthase. And in case of gluconeogenesis, it activates phosphoenol pyruvate carboxykinase and activates glucose 6-phosphatase. ঠিক আছে? Now coming to role of insulin. Role of insulin. কি হলো কিছু সমস্যা? কোনো প্রবলেম? Role of insulin. Insulin, it is also a peptide hormone secreted from beta cell of pancreas. It acts via tyrosine kinase cascade pathway. This is also a name of signaling pathway, that is mechanism of hormonal action, tyrosine kinase cascade pathway. You will read in details. Okay. So insulin acts via using tyrosine kinase cascade pathway, and it is secreted from beta cell, and when blood glucose level starts falling, then insulin secretion starts. Okay. So let's see what are the effect over glycolysis. It activates pyruvate kinase. Pyruvate kinase. It also activates phosphofructokinase. That means phosphofructokinase 1. It also activates pyruvate dehydrogenase. Okay. Pyruvate dehydrogenase from which step to which? Pyruvate to acetyl CoA. Very good. So this is effect over glycolysis. Now coming to glycogen metabolism. PFK1, that is for glycolysis. Okay. Glycogen metabolism, this is opposite to action of glucagon. That means it will inhibit glycogen phosphorylase and it will activate glycogen synthase. Opposite to glucagon. ঠিক আছে? Inhibit glycogen phosphorylase and activate glycogen synthase. Now in case of gluconeogenesis, it inhibits phosphoenol pyruvate carboxykinase. It inhibits pyruvate carboxylase, another enzyme, carboxylase. It inhibits fructose 1,6-bisphosphatase. It also inhibits glucose 6-phosphatase. Okay. So these are the inhibition. Okay. Among the action of the insulin, what happens? This is the pancreatic cell. So if there is glucose, glucose will enter via GLUT2 receptor, enter into the pancreas, and it will send some signal and insulin is secreted. Okay, insulin is secreted. In other cell, other extrahepatic cell, what happens? There will be GLUT4, synthesis of GLUT4, any type of receptor is chemical nature is, what is the chemical nature of any type of receptor? Protein. Okay, so it will be synthesized within the cell, that is reticuloendothelial system. Okay, so it will be synthesized within the cell, but for what is the function of GLUT? To uptake the glucose. So for its function, it must be carried into the cell membrane. Okay, it must be carried into the cell membrane. Cell membrane আসবে তবেই না ফাংশন করতে পারবে. So mobilization of GLUT4 receptor from inside cell to the cell membrane, it is done by the insulin. It is done by the insulin. Okay, that's why it is called that GLUT4 is insulin sensitive. Okay, when insulin will come, then GLUT4 will come to the cell surface, that is in the cell membrane. Okay, the cell membrane আসবে, after that glucose will be transported inside the cell. That's why GLUT4 is called insulin sensitive. If there is no insulin, then no mobilization of GLUT4, so no uptake of glucose. Okay, no uptake of glucose, and there will be glucose will remain into the blood, so it will give rise to diabetes mellitus. Okay, so this is very important. GLUT4 is very important. বোঝা গেছে যে ডিফেক্ট হয় এই কারণেই ডায়াবেটিস মেলাইটাস। ঠিক আছে, so role of glucagon and role of insulin is completed. Now role of glucocorticoid and role of catecholamine. Role of glucocorticoid. Glucocorticoid is synthesized in chronic stress condition. Chronic stress condition. It generally activates gluconeogenesis. It generally activates gluconeogenesis by activating all these enzymes. Okay, all these enzymes. It generally activates gluconeogenesis, and also by activating aminotransferases. Aminotransferases will help to release amino acid, so that these amino acid can participate into gluconeogenesis. Okay, so main effect over gluconeogenesis. By helping gluconeogenesis, glucocorticoid that helps to increase level of blood glucose. The last is catecholamine. That means epinephrine, norepinephrine. Catecholamine. This is secreted in acute stress condition. Acute stress condition means heavy exercise, exposure to cold, psychological emergency condition. Okay, so it is synthesized in acute stress condition, and it acts mainly by activating glycogenolysis. Glycogenolysis. It activates glycogenolysis, so breakdown of glycogen, so it will give rise to glucose molecule. Okay, so we have completed the 4 hormone, that is glucagon, insulin, glucocorticoid and catecholamine. Okay, so regulation of blood glucose can come as a long question, then you have to write all the things. Okay, or it may come as a short note, then you just mention the heading, all the heading you have to must mention, and write the things in brief, then no need to detailing of the enzyme. Okay, in brief just you read. Short note to 5 marks for that. Yeah. And this is all for today. Anyone can summarize today's class? Yes, তুমি বলো, summarize করো today's কি point. Just if a question comes about regulation of blood glucose, then বসেই বলো, অসুবিধা নেই, খাতা দেখেও বলতে পারো। ফার্স্ট
ব্লাড গ্লুকোজ রেগুলেশন এ
হ্যাঁ
ব্লাড গ্লুকোজ যেটা নরমাল লেভেল,
হ্যাঁ ফার্স্ট নরমাল লেভেল। ওকে,
after postprandial stage সেটা below 140.
ওকে,
সো এটা থেকে যদি 70 নিচে চলে যায় সেটা হাইপোগ্লাইসেমিয়া।
দ্যাট মিন্স importance of hypoglycemia and hyperglycemia.
যদি তার 140 বেশি চলে যায়, that is hyperglycemia.
Hyperglycemia.
So hypoglycemia বলতে মানে ব্লাড
Okay, just tell the heading, then the next heading will be.
তো এই ব্লাড গ্লুকোজ লেভেলকে নরমাল লেভেলে আনার জন্য, হাইপোগ্লাইসেমিক কন্ডিশনকে নরমালে আনার জন্য ফার্স্ট ইজ ওই গ্লাইকোলাইসিস কে ইনহিবিট করতে হবে।
No, then you I'm বলে দিচ্ছি, you first mention the normal blood glucose level, then what will happen if it goes below or if it goes beyond the upper limit, then you write what are the factors that causing addition of glucose, what are the factors causing leaving of blood glucose from blood, then you write what happens in fasting state, then you write what happens in fed state, then you write role of the endocrine. Within endocrine you have to mention action of glucagon, action of insulin, action of glucocorticoid and action of catecholamine. Okay, these are the headings.